Welcome back. You're watching McLaren Port Huron's Today's Health, and on this segment we're going to be talking with the Vice President of Nursing and Chief Nursing Officer Jennifer Montgomery about how this is going to impact the patient. Jennifer, welcome to Today's Health.
I'm excited to be here, Barb. Thanks for having me.
Well, you know, $162 million expansion on renovation project, the addition of the Karmanos Cancer Institute on campus. That is a huge amount of stuff going along, and what I really want to know is, how's it going to improve patient care?
I think what you're going to see is as we design the building and as we move forward, we're going to look at how we do things so that we bring the care right to the patient. We're going to look at our processes around the building and make it easier for the patient. It's all about those interactions and how the patient interfaces with us and how we include their families and make it easy for them to navigate healthcare this day.
Well, and you have a great opportunity, like you said, because when you're kind of breaking things and changing things, you can say, how can we do this better?
Absolutely, and we have really looked to some experts around the country to bring us new ideas and creativity as we design. And I think we're really going to see for our community here that the interactions are going to change and the way that we talk with each other and work with each other are going to start to change. We've designed areas that will be specifically for families to be there with their loved ones. We've designed areas for caregivers to talk, to bring doctors and nurses and physical therapists and respiratory therapists all into the same area so we can work as a team to care for that patient.
Well, you mentioned some private rooms, and we've heard a little bit about that, and of course we all prefer to be sick in private, but other than that, what will that enhancement add to patient care?
You know, private rooms are going to do a lot of things. They're going to help us with infection prevention, which is, you know, #1 priority. When people come to the hospitals, we want them to get well. We want to make sure that we're putting them in an environment that's safe for them. It's going to allow their families to stay with them, which gives them a sense of comfort and helps with rest and relaxation and really that whole healing aspect. And then again, it's also going to give us an area to interact away from everyone that's going on in the hospital. All those things that make noise and distractions. And this way, when we're teaching and we're trying to find out what the patient really needs, we're going to have a quiet area to do that in.
Yeah, that sounds absolutely wonderful. You know, we've talked over the years, you and I have talked, and I've talked to the rest of your cancer care team about the exceptional care that you provide here. And I'm wondering how the addition of the Karmanos Cancer Institute will enhance the care.
You're correct. We have really focused on cancer care throughout the years here, and this is just going to take us right up to the next level. We are already accredited with an Outstanding Achievement Award by the Commission on Cancer, and so while we're proud of that, Karmanos is going to bring us even more opportunities to exceed in specialty areas. They'll bring trials here. We'll open up those cancer trials to our patients. They won't have to leave the community. Currently, we think that about 60% of our patients at some point leave the community for cancer care. We want to keep those patients here right in town and give them what they need here locally.
Well, switching gears a little bit, you know, those of us that have been in the community for a while kind of think the emergency center is pretty new and pretty spectacular. And so I'm wondering why you would decide to move it over to the new patient tower.
You know, part of this is how we've been working with the architects in our new design. And as you look at what's going in the new tower, we expect that we're going to move our cardiac cath labs over there, our ICUs, our other ORs. So it really makes sense that as we're seeking trauma level 3 certification, that putting that emergency center right underneath those ORs and right underneath the ICU is just going to help with that whole patient flow process and treating those patients very quickly and getting what they need right to them.
Well, I was going to ask you, because we have taped in recent weeks about all the things that you're watching the time on. And so does that follow that even transfer time is important in that?
Transfer time is absolutely important. As you look at our trauma program and our stroke certification, and then also our cardiac program, all of those things have time limits. Time from you hit the door till you get to a CAT scan, or from the time you hit the door until we can give you a medication. And so lining all of those critical features right on top of each other in the new tower is going to help us make sure we hit those times.
What closing thoughts would you like to leave with our viewers?
You know, I think the most important thing is, as we talk about the tower and the expenses and the size, at the end of the day, it's all about the patient. And what we're doing here is really redesigning ourselves so that we can better interact with our patients.
Well, it's a very exciting time for you. I look forward to talking to you lots about this in the future. Thank you for joining us.
Thanks, Barb.
Stay with us. We'll be right back.